Okay, so when I explain manual muscle testing to a client, I will explain that I'm checking their strength, I'm checking the contractibility of their muscle, and I'm going to be telling them that I'm going to be giving them opposing manual resistance, such as when I'm going to be holding the body part, I will tell them I'm going to try to push you, don't let me, and I'm going to explain to them there's grades and there's different levels of strengths if they inquire about that. Okay, hi, good evening. Okay, so when I'm explaining range of motion to a client such as Phyllis, I would definitely talk to them about the ability of the body part to be fully flexed or extended, and I will explain that range of motion testing will test how far they can move their body part around their joint. I will also demonstrate it before so that they'll really understand the full meaning of what it is. Okay, so for the assessment of choice, I picked the stereognosis test, where I'm going to be testing, I'm going to be explaining to the patient the purpose of the test. I'm going to be asking the patient to close their eyes, and I'm going to be placing different items in their hand. I'm going to be starting with the affected arm, and then I'm going to try to use different textures and different temperature of items. For example, like a battery, a piece of cloth, a comb, and I'm gonna test the affected side first and see how many the client can identify. Usually, it would take 2 to 3 seconds for the client to identify, and then I'm going to be moving on to the other side, the less affected side, and I'm going to be checking the same things, and I'm going to see that that the client is not that the deficit is not due to cognition or due to other things, and that they are due to the deficits of touch. Okay, so when doing sensory testing, I'm going to have the patient, I'm going to explain the procedure. I'm going to tell them that I'm going to, the purpose of this assignment, that I'm going to check the feeling in their arms, in their legs, in their trunk. I'm going to ask them to close their eyes, and then I'm going to start distally, either with the arms or the leg, and I'm going to apply the same amount of pressure in each side of the body and in the same location of the body. And according to the responses, I'll know if they have an impairment. And I'm going to continue randomly, but in the same location on the right and the left.